Hello guys, I am back with another video on case study. Today I am going to discuss ACE inhibitors. My name is Abrar Pathan. So let us begin. So question: a 56-year-old man with hypertension comes to the physician for a follow-up examination. His BP is 165 by 92 mm of Hg on the left arm and 162 by 90 mm of Hg on the right arm. He reports that he is adherent with his medication and exercise regimen. The physician adds the drug to his antihypertensive medication regimen. This drug increases serum renin level, angiotensin I and angiotensin II levels, and decreases serum aldosterone levels without affecting bradykinin levels. Which of the following drugs was most likely added to this patient's medication? So we have got 6 options: candidacetin, aldosterone, verapamil, lisinopril, triamtram, or metoprolol. So guys, what is your answer? Tell me. Before guessing the answer, I would like to give you a tip. The drug that was most likely prescribed for this patient is used as an alternative for the ACE inhibitors in patients who cannot tolerate ACE inhibitors due to bradykinin-induced side effects like dry cough. Okay, so let me rephrase this statement. So I am asking you that which drug is given when the ACE inhibitors are contraindicated. Okay, so please try to answer this question. To understand this ACE inhibitors, we need to learn the RAS system, that is the renin angiotensin aldosterone system. So guys, whenever in our body there is a low BP due to NaCl loss, hypotonic urine, or blood pressure fall, or filtration rate GFR is low. Okay, so these all stimulus will stimulate renin release. Okay, and this renin will convert angiotensinogen into angiotensin I. Okay, now this angiotensin I will get converted into angiotensin II with the help of a ACE enzyme, that is the angiotensin converting enzyme, which is found in the liver. Okay, so this angiotensin II, it has various effects, like it will cause arteriole vasoconstriction. Therefore it will increase sympathetic activation. So this angiotensin II will cause arteriole vasoconstriction and sympathetic activation. Okay, this will drastically decrease the GFR for the short term. Okay, but this will increase the GFR in the long term. Okay, and this angiotensin II will also cause aldosterone release, which will aldosterone will cause sodium and water to be uptaken from the nephron. Okay, so this will cause a sodium retention in the blood. Okay, and this will cause a increase in BP. Okay, and so that is the normal response of the body to the hypotension. Okay, now in the case of hypertension, okay, we give ACE inhibitors, ARBs, that is the angiotensin receptor blockers, and L-carnitine. Okay, and rarely we give aldosterone receptor antagonist to cause inhibition of these respective enzymes and therefore cause hypertension or the low BP. Now coming to the mechanism of action of ACE inhibitors. So these are this will inhibit the ACE enzyme, that is the angiotensin converting enzyme, which will decrease the conversion of angiotensin 1 to the angiotensin 2, and main effects are the less angiotensin 2 in the blood, that will cause less vasoconstriction, that will cause less BB, that will cause low secretion of aldosterone, that will cause aldosterone is responsible for taking sodium and water inside the body. So as this aldosterone will be inhibited, so there will be less reabsorption of sodium and water from the blood, from the and this will cause a low BP. And dilatation of efferent arteriole will cause a decrease in GFR and decrease in filtration fraction. And this is the most important breakdown of bradykinin. So guys, this bradykinin, it's very important for our lungs, and if it remains in the lungs, it will cause a vasodilation, decrease in BP, and also it will cause dry cough and peripheral angioedema. So all ACE inhibitors end in suffix pril, and all ARBs, that is the angiotensin receptor blockers, they end in suffix stan, like valsartan, losartan, and pril like lisinopril, captopril, enalapril. Now coming to the adverse effects, there is increase in bradykinin concentration when we give ACE inhibitors, so which can lead to dry cough. This can be treated by discontinuing ACE inhibitors. Consider giving ARBs instead of ACE inhibitors. And bradykinin mediated angioedema due to increased vascular permeability and vasodilation. And ACE inhibitors will cause dry cough and angioedema. Only ACE inhibitors will cause dry cough and angioedema. This ARBs won't cause this. And adverse effects of both ACE and ARBs are the hypertension. Because they are used to treat the hypertension. So when they treat the hypertension, they will cause hypertension. That's obvious. And they both will alter the kidney function. Why? Because they will decrease BB and they'll vasodilate the arterioles, efferent arterioles. Which will cause a low GFR in the short term. In the short term, they will cause low GFR. In the long term, they will cause high GFR. So guys, our answer is candesartan, because it is ARB and there is no dry cough in the case of ARBs, and there is no angioedema, because the ARBs, they will not cause any inhibition of bradykinin. The bradykinin will convert into the inactive metabolites. So candesartan, which is an angiotensin receptor blocker, would inhibit the downstream effects of the angiotensin II receptor type 81, such as vasoconstriction and aldosterone release. This leads to lower level of aldosterone and decreased reabsorption of sodium and water. To compensate for decreased sodium and water reabsorption, the JG apparatus, that is a juxtaglomerular apparatus, will release more renin, which will subsequently increase the level of both angiotensin 1 and angiotensin 2. Meanwhile, bradykinin levels are not affected, as ARBs have no effect on ACE. This is very important. ACE inhibitors, they will affect the bradykinin levels, but ARBs, they won't. So that's why in the ACE inhibitors we get dry cough and angioedema as side effects, but in the case of ARBs, we don't get these side effects. Why? Because ARBs, they don't act on the bradykinin. Okay. So yeah guys, that's it for today, and thank you for watching. And please do let me know which case study do you want next. Okay, bye bye.